Hi both. So tell me about yourselves and the role you've played on the Change Programme. How long have you been on it?
I've been involved in the Change Programme since the kick-off date. What's that, 2.5 years or so? So I'm Assistant Director in Portsmouth, so I've been overseeing the work in Portsmouth, but also working alongside East Sussex, West Sussex and Brighton in our South East partnership, and chair the steering group around that partnership, which has been really good fun to work with local authorities that I haven't worked with for a while, so that's good.
And I'm the Education Partnership and School Inclusion Manager, and I've been part of the Change Programme in terms of supporting the work around workforce development and ordinarily available provision since the beginning, and then I've been the lead for Portsmouth and the development of the LISO since July last year.
Brilliant, thank you. Tell me about how your individual roles have played a critical part in the journey that you've been on in Portsmouth towards inclusion.
Yeah, so my role kind of spans education, social care, and to some extent health. Less so these days. I just spend a little bit of time in the local ICB. So it's been really useful to kind of join up the work that's been taking place in SEND alongside the work, the social care reforms, and alongside other kind of things like the emerging Best Start in Life strategy, trying to find those linkages between all of those kind of work streams has been really helpful and really useful. There's some kind of synergies that kind of help us work those things through together. In particular, I mean, we've had quite a strong SEND partnership for a number of years in Portsmouth. One of the things that we kind of reflected on that's been really, really helpful is how the Change Programme has helped us fold in alternative provision into the SEND much more tightly. Alternative provision agenda felt like a kind of over there agenda, I think, beforehand, and I think through the Change Programme, the work that we've particularly done on alternative provision in the city has really kind of brought that into the SEND space, and that's been really useful. And also one of the main features of our programme has been around LSEC, the early language support, and obviously as a health model, working alongside colleagues in the Integrated Care Board to think about speech and language development of children and how we can kind of do that across a more system-wide basis has been a good, rich conversation to be had over the last couple of years.
My role sits specifically within education, and my background is in education as a SENCO and as an assistant head in secondary. But as the Education Partnership Manager, the partnerships in Portsmouth and the Education Partnership, which is now in its 10th year, have been really important and really good vehicles for us to take the Change Programme work through. So we have quite a disparate landscape in Portsmouth with 14 different multi-academy trusts working across 61 schools, and our Education Partnership brings all of those trusts together, which has enabled us to do some of this work more effectively by engaging with all of our different multi-academy trusts as well as our local authority maintained schools, and working alongside our SENCOs over a number of years and the different partnerships we've got there, and our social emotional mental health partnership, bringing together the different partners and agencies, and the support that was already there was almost like the foundation for our LISO. We had the essence of that was there in place, and the LISO was very much able to build on that and give a stronger mandate to that kind of work. But the way that we've been able to collaborate across the city and develop those relationships gave us a really strong platform to take this work forward.
And tell me more about that. Both of you talked about the relationships and stakeholders, and I think throughout the Change Programme, when we've spoken about Portsmouth, the one thing that has strongly emerged is creating that real sense of civic partnership in your one Portsmouth, but being in a very a context that's quite academized. How have you managed to take and create that culture?
We've had to do it quite intentionally, so working alongside and really explicit about what we're doing and why we're doing it. So in the last few years, we've actually invested very much in relational and restorative practice. Some of that work has been led and modelled by one of our schools, which is part of a multi-academy trust, but that's alongside the work we've been doing across the City Council and across partners right across the council to develop that relational approach. But by having a school-led model within the Education Partnership, that's helped to kind of say this is not just about what the City Council is doing, it's what schools are doing, it's what school leaders are doing, but then as the council and with the consensus and agreement of our schools through the Education Partnership, we were able to invest in that, which means we've been working alongside our leaders and developing that collaboration across different schools, but doing it really intentionally. We started the education partnership with kind of having the trusts talking to each other and bringing their items to the strategic board, and actually over time what we realised is we were all working to provide the best we possibly could for our children. There is a sense of ownership. These are all Portsmouth's children, and actually, and the inclusion agenda is very much the shared agenda. So even though the trusts absolutely maintain their own roles and responsibilities around the school improvement agenda, what's really clear is you don't get school improvement without a strong inclusion agenda, and actually there is a shared ownership of that agenda. We are geographically small, which maybe makes it a little bit easier, but I don't think that is why it works. I think it's the intentionality and that buy-in from people to understand that, yeah, these are all our children. We need to work collectively to support them and get the best provision in place for them.
And did you find bringing them together, you'd have people with varied sort of interests to begin with to start working together? So was that a long journey that you had to go on? But when you say you were intentional about it, were there certain things you did to be intentional and make sure people are going on that journey with you?
The schools, are you talking about the different? Yeah.
Yeah, I mean, we have a very kind of rich landscape of multi-agency partnerships, not just in SEND. So think about mental health agenda, the physical health agenda, public health and nursing, and we always ensure that we have representatives from schools and all of those kind of partnership groups and working groups. But also, it's really important to say parents and carers as well. So we've got a very vibrant culture around co-production, a really excellent parent and carer forum that kind of has walked alongside the local authority and other partners ever since the SEND agenda kind of began, even before the original legislation. So co-production is kind of embedded within our culture, and we see that in schools as well in terms of working really effectively with our parent hubs, for example, that we created in and around schools. And I think it's that bit that, as Sarah's alluded to, I think there's that bit that we feel a culture, we've developed a culture of every child in Portsmouth, it's everybody's responsibility. It's not my child versus your child, it's not my school versus your school, or my service versus your service. It's genuinely a kind of owned system. And you know, we just talk about partnerships all the time, and we've always been got a strong reputation, and we can see it in our inspection results, whether it's in social care or SEND, around the kind of quality of partnerships across the system. So it's something, as Sarah said, it's intentional rather than accidental, and I think that's really important. If you start from that place, then actually it makes work much easier, and it makes innovation much easier if you're actually working together to create good and effective services for children.
And I think one of the things that strikes me is it's that culture that enables you to do that across every single kind of school or child in Portsmouth. Hayden, tell me a bit more about the journey, because you wear multiple hats, so you used to work with the ICB as well. So tell me a bit more about how that journey's been and how getting health to play a bit more of a role has been beneficial.
Yeah, absolutely. Yeah, so I was kind of there at the start of the Hampshire and Isle of Wight Integrated Care Board, when a merging of 7 clinical commissioning groups across Hampshire, Isle of Wight, Portsmouth and Southampton. And interesting times, even more interesting times now with the kind of the reduction in headcount and ICBs. That's obviously having an impact, isn't it, across the country around relationships between ICBs and local SEND partnerships. We've been, so I was involved in kind of creating the original kind of children's strategy for health, and we focused very much on 7 particular priorities that were very much aligned with the SEND agenda in the 4 local authorities. Lots of debates in those days around place versus ICB and all this kind of language, hospital footprints versus GP footprints versus school footprints, all that kind of interesting debates. And I think we've landed in a reasonably good place. I mean, our ICB is very committed to children, and is committed to making sure that the language that we've used in the integrated care system previously was around children are 25% of today's population, and they're 100% of tomorrow's population. So if we don't meet health needs early on, then actually all we're doing is generating problems down the line in terms of costs and waiting lists in the NHS. So, and that's landed effectively within, very difficult conversations that ICBs have got to have at the moment around where they focus their energy and resources. So, again, have we made our own luck or have we been lucky? I don't know. I think there's been a really strong relationship. I think colleagues in the ICB have worked really well with directors of public health in the 4 local authorities and with directors of children's services in the 4 local authorities. And there's, again, to go back to that word, an intentionality in the ICB to listen to local authorities and work alongside the local authorities. So that's been a very healthy relationship despite all the challenges that we're facing.
And tell me a bit more about the benefit that has had on the way you've been able to deliver your services.
Oh, huge benefit. So even significant ICB funding that's gone into services for children absent from school, for example. So we have a service that's specifically funded by the NHS, focusing on children that are severely absent from school for reasons to do with medical reasons or indeed emotionally based school avoidance. That's fully funded by the ICB, so that's an excellent example. We are currently exploring with the ICB the learning in Portsmouth around LSEC, how do we spread that out across Hampshire, the Isle of Wight and Southampton with less money, but what's the learning there in terms of alternatively qualified speech and language assistants to be able to spread the learning and the huge benefits that we've seen of LSEC in Portsmouth. How do we have that across a much wider geographical footprint funded by the NHS? With the benefit of reducing waiting times for speech and language therapy, but also the benefits for better speech and language development for children, which we all know is a bit of a silver bullet in terms of child outcomes later on in life.
And if you were to share a top tip, for example, with other local areas, because one of the things currently in the current landscape is what we hear a lot about is it's really difficult to get health or ICBs to engage, especially with the kind of more broader policy and contextual changes. How have you worked with ICBs in a different way to get them on board to put funding towards some of these programs to see the benefits you're seeing?
Yeah, I mean, my advice would always be develop a shared outcomes framework. If you're working towards, we can't keep separating our children into lumps of outcomes, from education outcomes to health outcomes to safeguarding outcomes. They're all interdependent, they're all related. So we've got mutual benefit by working together to say, actually, so if you go back to the language development one, if we develop language early on through education interventions and speech and language interventions, then actually mental health outcomes are better, education outcomes are better, offending outcomes are better. So it is about a shared outcomes framework. Now, that's different from where's the money on the table. But actually, if you start from the place of, well, if you pay for that bit and we pay for this bit, how can we get a coherency around children or around schools? So the LISO is a beautiful example of that, where there are some services going into schools that are local authority funded, some are traded services that schools pay for, some are health funded. I don't really care who funds which bit, we just got to make sure that everybody is contributing towards that total pot, which helps us drive inclusion and better outcome for children.
And that's very much talking about doing some of your pooled budgets, which is probably the hardest thing to do.
And pooled budgets are very hard, but aligned budgets are easy.
Yeah. So tell us the difference. How do you see the difference?
Yeah, so I mean, you can get into the kind of technocratics of kind of pooling budgets, and you'll dance around the handbags of Section 75 agreements and all that kind of stuff. And I've been down that path. It's not a path I particularly want to go down again. But you can align funding. You say, actually, if the NHS contributes to that bit and the local authority does that bit, how does that add up into something which is bigger than the sum of its parts? And you can get into all those debates around, who funds which bit. A bit like we do when we have kind of packages of care for individual children. But actually, if the agreement is that we will do this together and we will work through together where the gaps are and where the overlaps are, because you'll often get overlaps. If we can unpick the overlaps, then we can use resources much more effectively. But let's have a shared outcomes framework which says this is the direction in which we're heading.
Thank you. Tell me a bit more about your offer. So you mentioned the universal offer. Actually, how have you moved from a point where maybe you had a lot of services but there was a lot of duplication to more of a coordinated services that schools see the benefit of? You've got different schools, different needs. So how have you moved to that point of having a coordinated service that meets the need of different pupils and populations.
So we're still very much on that journey, but we're seeing really quite rapid progress through that local inclusion support offer, bringing the different partners around the table, starting with a little bit of looking what is out there. And the fascinating bit was there is a lot more than, even though we knew there was probably more than we thought there was so much that when we did map it all, and we'd done that previously through our SEMH partnership, and realised that there was a lot more, because looking at those different pockets, what's traded, what do schools already do, what do other partners do. With the LISO, we've gone beyond that SEMH to all areas of SEND, and what we realised that the number of partners contributing to that inclusion offer is actually huge. There are probably still some gaps in the system, but what we're still trying to drill down is what are the actual gaps and what is sometimes the perception in the gaps, because actually somebody else might already be doing that, and we're in that exploratory stage where we're really starting to see where there is some duplication and some overlap, or actually where we can slightly realign services to better join things up so that we're not doing that duplication. So bringing partners around the table, and we've literally brought them around the table. They are meeting weekly, and we started off with what we call a core team, which was a relatively small group of people representing some health representation, some care, some safeguarding and some education improvement. And actually, as we've done more of that, we've had more and more people joining those weekly meetings because they realise it's actually a really good investment of their time to look at what are we doing, how do we join it up, and how do we align it. So our ND teams, our MHSTs, for example, and actually we've got a much more streamlined offer, and we're finessing a little bit more the lead professional role, so looking at coordinating a team around the school with one named contact, which schools are really valuing, rather than going out to 4 or 5 different people and finding out what their service offers. They're able to talk to one person who is then liaising with all of those different services to make sure that the different bits of work that are going on at that systemic level are joined up and coordinated, and where people are still doing the individual pupil level work, they are at least aware of and aligned with the more systemic and whole school work to develop that kind of mainstream practice to look at that shifting culture as well as meeting the needs of individual. So we started small, we're growing bigger. I think as things develop, we will change. We will continue to change and develop as we see how things align, and the better people understand what everyone else is doing, and the way that different services are commissioned has meant that people have, with the best intention of the world, actually ended up working in silos to some extent or another, and we've started to really break that down. And we've got operational managers very much aligning the way that they work and collectively sharing their intelligence about schools and making it easier for us to know what everyone else is doing, and for schools to much better understand. And I say schools, I also mean early year settings and post-16. We're going right across the piece in Portsmouth, and that's really important, particularly with that early years piece, to really understand, working on the LSEC work as well, making sure that children's needs are well understood as they come in to schools, and schools are better equipped to meet their needs as they come in. And a lot of the services that are currently commissioned have been focused on that 5 to 16, and actually we're looking at bringing that a much more continual support and resource.
And I guess just as you're talking, what strikes me is having that approach to your universal offer means you can think about your workforce and your LSEC teams and things differently as well. And you can share them across the board rather than just having them dedicated to a specific setting or cohort.
And the workforce piece has been quite interesting as well. So again, in the earlier stages of the change programme, we were looking at developing a skills and knowledge framework, competencies framework for sort of the universal workforce within children's services, not just in education. What is it that everyone needs to know and needs to do? And that was absolutely co-produced. Young people told us that they want what they wanted people to know and to do in order to better meet their needs. Parents and carers also very much fed into that, particularly through the MD work as well. So we've got that understanding of what do they want people to know and to do, and sometimes it's really basic and really obvious, but actually really difficult to do consistently. So we've developed that into a framework, and then looked at, well, if you're looking to further develop some of these skills, what training and support might you need to do that? And again, by mapping the huge amount of training that is available, offered by different partners across the system, to be able to support professionals to navigate that.
We'll work our way through that. So in terms of the kind of LISO, I think we set off with some intentional principles. So one of those, we were talking about this the other day, weren't we, Sarah? In terms of, it's incumbent on those of us outside of schools to organise ourselves in a way that's most helpful for schools. It's incredibly busy in a school, isn't it? And to be able to have the time and the capacity to lift your head out of a school of 1,000 children to find out what service delivery is available beyond your school gate is really hard. So it's down to us to do that, to make sense of the system for our school leaders. So we've taken that as a kind of a principle. I think the other principle is we intentionally look for good practice and share good and effective practice. So it's not a deficit model. It's not a let's go and throw lots of resource at our uninclusive schools. It's a let's intentionally find good and effective practice and put school leaders in touch with each other around emerging and effective practice, and that's really important. But the other bit is not to overwhelm schools and not to give confusing support or advice or guidance, which is where that kind of team around the school notion comes from, is to make sure actually at this stage of development in your school's inclusion journey, these are the kind of things that we would recommend that you kind of look at and work alongside. But here's a package of support that's available for your school and your school leaders. And what we want to get into, much more, particularly the new Ofsted framework, is a shared sense of self-review. What our SENCOs have asked for is a really, really rich SENCO network that Sarah's been running for years, but a really, really clear message is that they want peer challenge and peer support. They want to actually go around to each other's schools and look at the quality of inclusion practice and where we can make some improvements together, and where we see good and outstanding practice that we can share across the city. So it goes back to that partnership piece, doesn't it? How do we not only have good partnerships between the local authority and health and schools and early year settings, but how do we continue to enrich the kind of relationships between schools? And I find most of our head teachers, they're Portsmouth head teachers before they're a trust head teacher. And they are there to serve Portsmouth children and want to work together in that kind of community of head teachers. And I think that's true of our SENCOs as well.
Yes. I think sometimes they're quite reluctant to share the good practice. It's just what they do. Yeah. And actually telling them what they're doing is really great, and we want other schools to learn and share from that. And I think it's also worth saying that we're working in both a proactive and a reactive way. Because, yes, schools may well be reaching out to either one partner or to the LISO asking for particular help or support or guidance around an issue, and we will absolutely respond to those. But we are also using the collective intelligence of the partners around the table and the data to reach out to schools and say we are noticing, and we're using data very much as, this is data that's in the public domain, data that schools already know, but don't necessarily all have in one place, because sometimes it's been quite hard to collect all of that. So we're pulling that all together, which SENCOs are really, really welcoming, the head teachers really welcoming seeing that inclusion data dashboard, those that haven't got that for themselves, but almost as a mirror to kind of look at, say, well, what is this telling you about your school? What is it telling us? And often it's telling us that there are figures there that might be examples of actually really strong practice or potentially areas for further development, but without having the questions around it. So using that data to really have those conversations, to explore and share that really good practice, but also to think, well, then what else might we be able to offer to support you on that journey? So the data is a really important part of the conversation. There are obviously some bits of data that we do pass judgment around, attendance, suspensions, exclusions, and those kind of things, but there's always a story to tell around that. And a lot of the other data, like the numbers of children on SEND support and the first primary areas of need and so on, are actually really interesting conversations to look at, how the school is meeting need, how they're identifying need, what particular expertise they might need within that school and what they have to offer. But that makes the conversation, as well as sharing the rich anecdotal information, actually having the data is really helpful. Schools need to know that. It's not just somebody thinking something. We've got that evidence base for the way we're working. But to reach out to them, I think, is a strength of the way that we're working. And some schools have really responded that way. We've noticed something and we've said, we've seen this and can we help you with? And they've really welcomed that approach.
tell me a bit more about, so you talked about sort of being proactive and really kind of embedding that way of working. Tell me more about how you've managed to take people on that journey, because everybody's job, as we said, will be so busy, and it's so easy to be in that cycle of delivering a reactive response to things. So how have you helped people or stakeholders manage the balance between being proactive and reactive?
Before I come on to that, I just want the other bit of proactive stuff that I haven't spoken about, because we're still developing, but we're really building on the strength of some of our parent hubs that we've developed through the ND in schools, where they've worked as an integral part of that work in developing the support for neurodivergent young people in schools. We've learned a lot from that, and we have asked our Parent Care Forum, our Portsmouth Parent Voice, to deliver more parent hubs looking at SEND and inclusion in its broader sense, so that parents have a safe space that they can go to, and PPV then act as that conduit to share the not pupil level information, obviously not talking about individual children and families, but actually particular issues. They will feed those back to the school to say, this is what parents are telling us about your school, and the school will obviously respond to those, but also to feed that into the LISO, into the Inclusion Hub, so that we can look at joining that up as an important part of our intelligence, so that whilst parents don't directly refer in or link into the LISO, their voice is absolutely heard in terms of the support that's needed. And how we get partners to respond to that, there's almost a little bit of FOMO going on, I think, now, because we've got so many people involved. We've had people who initially started off going, I don't think I've got the capacity to join that team on a weekly meeting when we started in October. We're now in March, and we've moved the room that we meet in. We meet in person because we think it's really important. Again, in terms of that intentional relational practice, we meet in person, we check in, we have a connection activity at the beginning of every meeting. So we're bringing ourselves as people as well as professionals to those meetings. We've moved the size of the room twice because it's not been big enough, because more people are joining and are continuing to attend, because they really value the richness of the discussions and the sharing of that information. And the intention always was that by being there and investing that time, it actually saves you time in the long run. And I think that people are seeing that it's not feeling like we're just sitting around talking and it becomes an onerous duty. It actually becomes a really good way of sharing practice and enabling everyone to be a little bit more efficient and effective with their time. And those conversations in the room can save you 20 emails, 4 phone calls and another 3 meetings, because you're all there and you're then working from a more coherent perspective.
Yeah, we've got sort of 15, 20 colleagues there, haven't we, from different services, and I think it's just really helpful. I think what they're getting out of it is, I didn't know you were doing that with that school. That's really, really helpful, that I now know what you're doing in that school, therefore I can kind of steer what I'm doing with that school. Or actually, I don't need to do that in that school because you're doing it. Yeah. So it's getting into that level of kind of coordination. Now, again, relatively straightforward in a city with 61 schools, a bit more straightforward than a large county. Completely understand that. But that richness of conversation which says, actually, so that's what you're doing, right? Okay. Now, what we want to get into more is, we've got the data piece, but that self-evaluation that schools that we alluded to earlier, so that we can make sure that the deployment of those resources is a little bit more proactively managed rather than happenstance. So we're still slightly in that space of, this is the historical relationship that a school's got with services. Is it the right suite of services if we go back to the school and say, actually, there's some other stuff that we can do to help based on the data, based on your self-assessment. So we're just at that bridge now, I think, of going back into saying, that's who you've been working with, and that's, is there some other support that we can give you to develop your practice? Or is there some other schools that we can kind of bring in to work with you to develop your practice even further? So that's the kind of point that we're getting at now. Even we're still learning what services do, and services I've commissioned that I suddenly realised I didn't know they did that. It's been quite an interesting journey, and it kind of makes you think about, actually, with a little bit of tinkering, we can steer some services towards that piece of work which would meet the needs of several schools. So we need to kind of get into that kind of space as well. We had a really interesting conversation literally the other day where a colleague had been kind of pulled into a school to do some work around neurodiversity. Actually, there's another colleague that's probably better placed to do some work around neurodiversity. Let's just save each other a bit of time, and we'll send this person in rather than that person in to go and work with that school. And they go, yeah, great, that's absolutely brilliant, because that frees me up to go and work with that school. Something that I do know more about. So that's good.
And I think, sorry, do you want to come?
Well, in terms of that self-assessment framework, we very much aligned it with the Ofsted framework as well. So from a school's perspective, because where we've tried before to do a local authority type of assessment, schools, some have engaged really well with that, but we've not had the full coverage because there's been a little bit of, well, what's in it for me as a school. Whereas actually we've trialled the framework that we're using at the moment with a number of schools, including some who have been through the new Ofsted framework, said actually this would have been really helpful to have done this beforehand. So to support them, if they've already done their own assessment, we're asking them to share that with us. So it's not a compulsory thing, but actually what we're finding is that schools think this would be really helpful for us, and it's supporting them on their journey already, as well as giving us that rich information across the whole city to enable us to better commission and deploy resources. And again, when we're working towards that expert at hand model, what will we want across the whole city to support those children and have that citywide picture rather than looking at pockets of isolation or the people that shout the loudest, because we want to make sure that it's an equitable offer across all of our schools and cities.
And just as both of you were talking, the thing that strikes me is you have to be very intentional about being proactive, and I think, striking that balance between reactive and proactive is at multiple levels, and it's not easy. You've got to make sure people have access to the right provision, but they understand how to access it, and you've got to make sure the relationships are in place. So it's a journey that you've been on. Is there any final thoughts? So if you were to share, say, top tips for local areas who are outside of the change programme, who haven't necessarily had the time or the support in the way that maybe you have, what would you say definitely sort of this is a top tip you should do regardless of your context? What would you say are some of your biggest barriers you've had to work through?
I mean, we were reflecting on the train and the way up, and what's been helpful, lots of things have been really helpful about the change programme, but just having that bit of money to be able to kind of invest in some really key posts. And obviously there is some resource coming with the white paper in the autumn. So particularly we've not touched on alternative provision, for example. So one of the things that we did was recruit an alternative provision commissioner, particularly to focus on non-school, non-registered provision and drive the standards of safeguarding and health and safety up for those on behalf of schools, and that's been really quite innovative in our space, and we're very, very pleased with that. So just having that little bit of money for those kind of key posts has been really useful. My top tip would be to bring whoever is going to be in your local inclusion hub or your expert at hands. I'm going to phrase this really carefully because I don't want it to be a judgment on schools at all. I don't expect schools to know what's available, because what's available is too complex, too difficult, too weird, too strangely funded. You don't quite know who to talk about. One minute it's an NHS service, then it's a voluntary sector service, then it's a local authority service. I don't expect our school leaders to do that. I expect us to do that. So we've got a leadership role to tidy the system up. So to use whatever resources available to make sure you're bang on clear what is available to help schools drive inclusive mainstream practice and bring those colleagues together into a robust process around what does data say, what does self-assessment say, how can we establish a really effective team around your school to drive up inclusive practice from a real strengths-based approach, not a deficit model, but a strengths-based approach, because every school does something really, really well. How do we build up from a really good practice, but pull in your colleagues from the whole system who've got a part to play?
I would absolutely agree with those points, and also one thing that the change programme I think has given us, and that the white paper will also give, is that mandate for people to work together, and that's been really important. So we had a really strong foundation through the good relationships, but actually the mandate of the change programme, or the authority of the change programme, brought those other partners around the table and allowed us to work much more systemically and much more holistically. The other thing about not expecting schools to know everything is not expecting schools to remember everything that we've told them. They get bombarded with so much information, and similarly with partners as well. I think reminding people that just because you've told something once, somebody something once, we can't expect people to remember it. We need to keep reminding people of that, and that's not a deficit thing. That is how the system should work and needs to work, and we need to keep reminding each other, including ourselves actually, of what we should be doing, what we are doing, what is available, whether it's changed or we just haven't used it, particularly for those lower incidence needs. You don't know where to go because you haven't needed to go there before. So someone might have sent an email 6 months ago, but you didn't need it then. So don't expect someone to remember it. Let's be proactive in reaching out and making information available.
Perfect. Thank you. Anything else you wanted to share before we wrap up?
What a miss. What a miss.